Well, now we'd like to welcome back Bob Keller from Keller Therapeutics of Newburyport on Water Street, specializing in pain relief. And Bob, good morning to you.
Good morning, Will. It's good to be back again.
Oh, it's nice to have you. You have such a pleasant voice.
Thank you, sir.
So it's got to be, but that's not your only weapon in pain relief, is it?
It is not.
Well, you're a Myokin pain relief practitioner, and that's what you're hanging your shingle on more and more these days. Why don't you tell us a little bit about that for folks who may not be familiar with the system?
Okay. Well, as you may or may not be aware, some people are not, the body's natural state is to be free of pain, free of numbness, and just feel good. Unfortunately, as we go through life, we get bumped, we get stressed, we get all kinds of things, and often the central nervous system makes some adjustments to our muscles that cause pain. So what I do is to try to re-educate the nervous system using very simple soft tissue manipulations to remind the body of that pain-free state that it really wants to be in.
So when you're in pain, some of the symptoms where they pop up first, go ahead.
Well, pain comes in many different forms, and often you'll have pain in many different parts of your body, some of which is a compensation for an injury somewhere else. You may have shoulder pain because of an old back injury. And so we try to treat those and in one fell swoop address all of the pains that are causing you problems.
So you're saying that muscles have memories?
Muscles definitely have memory, and the first part of every treatment that I do is to remove that destructive muscle memory. That's the crucial part. The second part is where we actually do the re-education so that the muscles no longer, or the nervous system rather, no longer feels there's any need for pain.
You wanted to talk about some patient experiences. Why don't you do that?
I would. Last month, if you recall, we talked about, we had a man here, Michael Sales, who had a neuroma in his foot, which was very painful, and we were able to treat that. What I wanted to do this month was to focus on the top of the body, the neck, and the shoulders. Many people these days have a lot of shoulder problems, whether it's frozen shoulder or maybe even going down into the arms and hands and carpal tunnel and things like that. We can treat many of these conditions and have done. I think one of my favorite patients, which among other things indicates the fact that there is no age requirement for Myokin treatments, it was 5 years old, in fact still is 5 years old, and she came with this pain in her neck and her shoulders, and of course at that age mostly the response is just grouch. I hate everything, I'm going to yell and scream and cry. So we started this treatment, and she was very unhappy about that too. But we got a little way into it, and she stopped grousing. And just as I was getting to the end of it, she said, "Okay, that's it." And she got up, was pain-free, and left.
Wow.
I love it. My favorite patient.
Yeah. It's a 5-year-old. And you go up to the other end of the spectrum too.
My oldest patient was 94.
Wow.
But neck and shoulder pains are very common these days, particularly with people who use computers a lot. And particularly because we generally have the keyboard in the wrong position, the screen in the wrong position, and there is no right position for everyone, but you kind of need to experiment so that you're stress-free while you're doing it. I have had one patient fairly recently who had a very severe shoulder pains and down into the upper back, in fact. And it was a result primarily of sitting at a computer hour after hour, day after day, and really not moving much. So we did a Myokin treatment, and after the first treatment there was some relief from the pain. But unfortunately, if you keep doing the things that cause the pain in the first place, it's a little hard to maintain that pain-free state. So after 3 sessions, however, progressive pain relief each time, we're able to relieve the pain pretty much permanently, and at that point we're able to suggest ways that this person might adjust the computer screen, adjust the keyboard, to move the mouse and so on, so that the pain would not come back.
That's right, because if you're pain-free and then you're doing something where the pain starts to come back, then that should put a mental note to you that maybe things need to be changed as far as physically around where you're working.
That's true, and we've also noticed that once we've got pain under control, very frequently, if the pain does come back, your central nervous system has learned how to fix it by itself. So just stopping what you're doing, resting for a few minutes, may often take away the pain automatically.
We're talking with Bob Keller of Keller Therapeutics on Water Street in Newburyport, a Myokin pain relief specialist. And why don't you tell us a little bit about that, because I know that in the past you've always mentioned that you keep your clothes on and there's no medication, and that's important stuff for some folks.
Well, it is. It's really a very attractive part of the treatments that I do. They are very short, 10 to 20 minutes usually, whether it's upper body or lower body. Some are faster than others. Patient is fully clothed. I even had one person who was wearing an overcoat. A little hard to feel the muscles in that case, but it worked. And I use no oils, no creams. So it's a very easy and pleasant experience. It's something you could come and do during your lunch hour as far as that goes.
So you have a lot of folks that come in for lunch hour?
I sometimes do. Yep.
Wow, that's neat. Now, you've been offering a discount to some of the patients, right?
For the last year or so, we've been offering really a 40% discount from what the list price of these treatments are. So patients have been paying $30 per session. What I'm doing now, as of 4th July, we're going to reduce that discount from 40% to 20% for new patients only. So new patients, as of 4th July, will be paying $40 instead of $30. Current patients, people who are on the books as of 4th July, will still pay $30 for the foreseeable future. So if anybody feels like trying it out, this is the time to do it.
Now, when they have the treatments done, sometimes they need to just come back to give their muscles a reminder.
They can keep coming back as long as they need to. In fact, more and more people realize that a maintenance treatment, maybe every couple of weeks, every month, every 6 weeks, depending on the situation, is the right thing to do.
Every time I see somebody who's got a cast on their arm, I'll say, "Oh, what happened? Did you break your arm?" "Oh, no, I had carpal tunnel syndrome." And I get the thought in my head, "Geez, you should have seen Bob Keller."
Feel free to recommend one. By the way, for every 2 people you recommend who come for a treatment, you get a free one.
Nice. Very nice. Well, that's even a bigger discount. And you've got such a nice website too. It's at what's it called? It's
Myokineast.
Okay.
MYOKINEAST.com.
And on it, you have a thing that says "Get Moving with Myokin."
There is, and we really expect 3 results from Myokin treatments. One, and perhaps the most important, is pain relief. The second is increased range of motion. And thirdly, an increased function of whatever the parts are that have been troublesome.
Now, when sometimes people get up out of a chair or out of a bed, they have pain in their lower back, and that's something that you can help with Myokin?
We have done with some patients with just exactly that problem. I have a terrible pain when I stand up out of the chair, so we did a few treatments, and that condition went away.
And I know sometimes people, they'll get numbness in their, the lower back hurts, and then they get numbness in their legs.
It's the same thing. The Myokin treatment, because we're doing this re-education process, is effective for pretty much any condition that has to do with the peripheral nervous system, which is your spine and so on. And numbness is part of that as well. Pain or numbness can be affected by Myokin.
Okay. All right. Hey, I want to thank you, Bob, for joining us. And it just sounds like a neat thing. You walk around all day long and you heal people. Well, you get rid of the pain, and that's healing people. That's a nice thing.
That's a lot of fun. Thank you for inviting me, man.
Oh, you're welcome. Bob Keller, Keller Therapeutics on Water Street, Newburyport, specializing in pain relief, Myokin therapist, Myokin specialist, and I want to thank you for joining us again.